sir.
Yeah, please.
Hello, my name is Pradeep Ramulu. I am going to speak to you today on the topic of whether physical activity can protect against eye disease. And I regret that we can't be there together in person, but I'm hoping I have the chance to meet all of you again sometime in the future. These are my disclosures, including disclosures from the National Institute of Health, which funded much of the work that I'm going to talk to you about today. We were interested in physical activity starting many years ago because physical activity is a cornerstone of health. People who are less active have a higher mortality rate, and they also have greater rates of multiple diseases, including heart disease, diabetes, osteoporosis, and cancer. Not surprisingly, people who are more active are also happier, and they have a better quality of life as well. An idea that we had several years ago, which has now become quite commonplace, is that we ought to really measure physical activity objectively using devices such as accelerometers, which calculate how many steps you perform or how much time you spent at higher levels of physical activity, such as moderate or vigorous physical activity. Not surprisingly, these are correlated with how much activity you actually do, such as how much energy you expend. And it's much more related to objective measures or objective outcomes than a self-reported physical activity. Here's some of that work shown here. This is a study that actually looked at correlations between subjective and objective physical activity, which were poor. And what they also did is they looked at how both self-reported activity and objective activity was related to a number of biomarkers. And in every case, what you see is that there's a higher Wald F score, meaning a stronger association for objective activity than self-reported activity. And this extends to a number of outcomes, including blood pressure, weight, and skin fold thickness, cholesterol, sugar, and multiple inflammatory markers as well. So while self-reported physical activity is important, it probably does not actually measure how much people move, but rather whether they feel like they can move. What we did find, which was also really kind of a big spur for our work, was that physical activity was significantly less than people who had uncorrectable visual acuity loss. This was work that was done by my student at the time, Jeff Willis, who found that people who had visual impairment did roughly half as much physical activity as those who had normal vision or uncorrected refractive error. What was really striking is that when you compare this effect of physical activity to numerous other conditions, it was really quite large. So people who had COPD or arthritis reduced their physical activity by 8 to 15%. Those who had diabetes or stroke reduced it by about a quarter. People who had congestive heart failure reduced it by about a third. But people whose vision was bilaterally impaired reduced it by about half. So it was actually the strongest factor with regards to activity restriction. This was one of the findings that we had, specifically looking at the association with diabetic retinopathy, which started getting us thinking that perhaps this is actually a protective effect as opposed to a downstream consequence of disease. We found that more physically active diabetics were less likely to have diabetic retinopathy. And amongst females, even just a modest amount of extra daily activity, 10 minutes a day, substantially lowered the chance that they would have moderate or severe retinopathy. And these effects were independent of their A1C, their blood pressure, or the disease duration. We also noted in the same NHANES data set that there were protective effects of physical activity against visual field damage. Specifically, those with bilateral visual field loss did 30% less physical activity as compared to those with normal sight. More recently, people have done more work from the same data set and shows that activity is lower in glaucoma patients. And they found that the odds of glaucoma was 10% lower for every 10% or 10-minute increase in daily moderate activity. And there was also a lower odds of glaucoma with higher average daily activity intensity. These associations extended to self-reported physical activity as well. And people who self-reported themselves as more active were less likely to have glaucoma. In the meantime, we were doing some of our own studies at Johns Hopkins Wilmer Eye Institute, looking at the association between visual field loss severity and objectively measured physical activity in glaucoma. And we found that individuals who had more severe glaucoma took fewer steps per day. The question then became, was this association just chance, or was it actually due to a protection between physical activity against glaucoma? Indeed, this idea of exercising protecting against glaucoma is not at all new. This is a study that was done 40 years ago now, which actually compared two groups, those with low tension glaucoma, in other words, individuals who got the disease despite not having a very strong risk factor of intraocular pressure, and ocular hypertensives, people who didn't get the disease despite having this very strong risk factor. And in fact, the primary thing, or one of the primary things that was actually different between these two groups, was their self-reported activity. That in the ocular hypertensives, many more reported exercising, and in the low tension glaucoma group, most people reported themselves as being sedentary. When we looked at our data, in our associative data, which found that visual field loss was associated with less physical activity, what was interesting is that this didn't actually seem to be a downstream consequence. And you can look at this by a mediation result. So what we found is that individuals who, we found this association between visual field loss and less physical activity. But when you see if this association goes away when you add in something such as fear of falling, it didn't go away, nor did it go away if you added in something such as driving cessation. In other words, this seemed to be independent of the other mobility problems that they were having. This led us to think that this may be actually a causative effect, in the sense that physical activity was actually causing the disease to some extent. This effect was specific to glaucoma. In age-related macular degeneration, less physical activity did seem to be the results of mobility problems. So specifically, a worse contrast sensitivity in AMD was associated with less physical activity, but this went away when you accounted for fear of falling. There's quite a bit of longitudinal data which actually suggests that that better fitness and more physical activity is protective against glaucoma and also other diseases such as cataract, though I won't show that here today. So this is a study that was done in male runners, and they caught them at a baseline age of 45 and followed them for 8 years. And what they found is that people who ran faster had less incident glaucoma, and there were no cases in men who could run very fast. So in other words, who ran a 10K at greater than 5 meters per second or 33 minutes for a 10K in the last 5 years. There was also a 50% decrease in incidence in men who ran more than 6 kilometers a day. They also did the study in women, but they couldn't analyze the results as too few women actually got glaucoma. So a very low incidence over 8 years, suggesting that this effect may even be more pronounced in women. There was also less incident diagnosed glaucoma in more active and more fit adults. In another study done by Meyer and colleagues, glaucoma was diagnosed by self-report, as was physical activity, and fitness was objectively measured. And they found that people who were more fit were less likely to get glaucoma, as were those who did more physical activity. What's more intriguing is that in mice, exercise has been shown to protect against age-related IOP damage to the electroretinogram. This is Jonathan Krauston's work, which showed that if you take older mice and you raise their pressure, their ERG amplitude goes down, but if you exercise those mice, you protect against it. Well, there's lots of factors that have been suggested to be protective against glaucoma through epidemiological studies, but what you really want to do to make sure you believe this is to see if there's a mechanism accounting for this association. And in exercise, there's a number of effects which have been shown that are beneficial physiologically, and so I think there's a lot of mechanism that's possible here. Specifically in mice, there's a protective effect of exercise through brain-derived neurotrophic factor and its receptor TrkB. So if you introduce a TrkB antagonist when you exercise animals, you block this ERG recovery or protection of exercise. Likewise, if you exercise mice that are haploinsufficient for brain-derived neurotrophic factor, you don't get the protection that you see as compared to a wild-type mouse. There's also human evidence that BDNF is released with exercise and that it is less available in patients with glaucoma. This shows that 4 hours after exercise, you can see plasma BDNF spike. And also in patients who have worse pattern standard deviation, their BDNF levels in the serum are lower. People have even shown that there's an alternate mechanism for exercise to be protective in that a 12-week aerobic conditioning program reduced IOP in sedentary ocular hypertensives, and after they stopped exercising, their intraocular pressure went right back into the 20s. More recently, people have shown better blood flow and tissue perfusion after 8 weeks of circuit training in older adults. So you can see that this HSCT or circuit training group did much better in tissue perfusion, RTP, and also in retinal blood flow as compared to a control group. There may be benefits of physical activity on treated glaucoma patients. In a study that we did, we looked at rates of change 5 years before and after a 1-week activity assessment, and we found that more active patients had slower progression, although the effect was mild. But they were independent of age, race, disease severity, and IOP. So do I tell my patients to exercise? Absolutely. There's strong suggestive benefits for a positive benefit. And while definitive evidence is lacking, advocating for exercise as good medicine. This is a recent review which actually kind of goes over some of the extensive positive benefits of physical activity, and also talks about how there's a substantial amount of population adjustable risk, which can actually be used to prevent a number of different conditions by exercise. Thank you.